It's nice to be here, and today we're going to talk mostly about vein health, venous insufficiency, and mostly about varicose veins. Most people think of varicose veins or spider veins as mostly a cosmetic problem, just something that you see and not necessarily something that could cause a larger problem in your legs or in your circulation. So we'll touch upon kind of some of the more severe things that could potentially happen in patients who have problems of venous insufficiency, and we'll kind of define that term a little more clearly as we go on and give you a sense of maybe if you're looking at your own legs, what is it that you have and what should you do and how should you think about it. So I guess the best way to start is to say, why is this an important problem? Why is this something that I'm here talking to you about? And it's something that's very common. And about more than 20% of women, 7% of men will suffer from some sort of venous disease in the United States. Venous disease itself can cause a problem of daily living. It can cause symptoms, pain, discomfort, limit your daily activities to a point where you can't function normally in what you should or need to do from a day-to-day basis. 6% of patients will have more advanced chronic venous disease, meaning they may not just have something visible on their skin like spider veins, but they may have something more serious like red, swollen, tender varicose veins that have developed a blood clot in them. The most severe problem that can arise when venous insufficiency occurs, and I keep using that term, but when blood is essentially pooling in the legs and causing too much pressure, is that it can damage the skin of the legs or the subcutaneous tissues in the legs. And when it does that, it can cause scarring, or at the very worst can cause breakdown of the skin over the lower leg, and the area that most commonly happens is down near the ankle. That can happen in up to 0.5% of patients. And just to get a number out there, in the literature they say 0.6 to 1.4% of patients have healed ulcers. So have a history of leaky veins causing too much pressure in the legs, at some point had an ulcer and then that's healed. And they're living with their increased pressure in the veins in their legs. And not to, I guess, poo-poo the idea that cosmetic issues are not a problem, but they can affect people's self-esteem and what they can wear, what they can do, what activities they can participate in. So that's always something to think about and be concerned with. Here we have kind of some small pictures, and I kept them small on purpose, so because some of them aren't nice to look at, but gives you a hodgepodge of what the spectrum of disease can be. So starting with spider veins, kind of the smallest veins within the skin layer, probably of least concern but can sometimes be painful. Varicose veins, which are larger, dilated, tortuous veins under the skin surface. And sometimes these are painful and sometimes these aren't painful, and sometimes these limit activity and sometimes they don't. Sometimes they bleed and sometimes they don't. Here we have some of the skin changes from having chronic pressure in the legs. So you can see these legs are a little bit more bluish, discolored. If I were to show you the inner ankle, it would probably be more scarred down. There might be some scar tissue that's formed there, or even worse, discoloration, or potentially breakdown of the skin in an ulcer. And again, we talked about before, here we have some red, swollen, lumpy, bumpy areas over some varicose veins. And that we term superficial thrombophlebitis, but that's basically all that means is a blood clot in a superficial vein or a varicose vein. And that's not something that's necessarily life-threatening, because it's unlikely for that to develop into something more serious like a pulmonary embolism, which is something you may have heard of, where a clot can travel to the lungs. But it is something that causes a lot of pain and discomfort and is something that can be treated and taken care of. So who gets varicose veins? Pretty much anybody and everybody can get varicose veins. We think of this as a disease of aging. We tend to see it more often as people age, and probably that has to do with a lot of what we're going to talk about further along, but pressure is really the problem in varicose veins. It's we live our lives standing on our feet, and as a result, blood needs to travel against gravity from your feet back to your heart. And it does that through your veins, and those veins are specially structured to do that. So all of us who stand are at risk for developing varicose veins. Now, some people have more risk or less risk depending on their history, their genetics, their what they do for a living, but we all have the properties there to develop varicose veins. More than 11 million men and 22 million women between the age of 40 and 80 in the United States have varicose veins. More than 2 million adults have chronic venous disease with skin changes or ulcers. So that's what we were talking about before. As that pressure builds up, it can affect the skin, break down the skin, the worst thing that could happen. And that's about 2 million people. So that's 10% of the people who have varicose veins, but still a large number. Just to give you a sense of how big of a problem, the scope of the problem as far as not just you who has a varicose vein that's painful, but the scope of the problem across all of society. This is a large medical cost. In the United States, we spend about between $150 million and $1 billion a year in treating people who have venous hypertension, increased venous pressure, or varicose veins. So that's a pretty big number as far as I can tell. And currently the vein community has been called to action to reduce the incidence of venous ulcers by 50% in the next 10 years. So that's something we want to make people aware of. We want people to know that if you have these skin changes, if you have varicose veins, it may not just be a cosmetic thing. Maybe you should at least be evaluated and check to see, are you going to progress to somebody who has an ulcer, and how can we prevent you from getting to that point? So what causes varicose veins? I kind of touched on this a little bit earlier. I tell everybody who comes in the office we don't really know. The truth is we have an idea. We know what's associated with varicose veins. We know that certain things people who have varicose veins have certain qualities that are in common. But is it the fact that people stand on their feet? Is it their genetic history? Is it any number of things that necessarily on their own cause you to develop varicose veins? Probably not. It's probably some combination of a lot of things that cause people to have varicose veins. Probably the one that has the strongest value, at least from what we can tell, is the genetic predisposition. People whose parents, siblings have varicose veins are more likely to have varicose veins. We do see more as we age, and again, that's because we stand on our feet. Gravity plays a large part in that, and the veins tire out, frankly. It's like anything that you, if you take a piece of plastic and you bend it once, it bends back. If you bend it many, many times, it won't bend back to where it started. The veins are kind of similar, so they stretch, and then they might recoil back. But if they stretch and stretch and stretch more and more over time, eventually they hit a point where they can't recoil anymore. And those are these varicose veins. Again, they're dilated, distended veins that can't recoil back down to their normal size. Because of that, hormonal changes play a big part in this. So pregnancy plays a part in this, not only because pregnancy increases blood flow through the body, so multiples of your normal blood flow during pregnancy, but also hormones. Hormones are there on purpose for things to stretch during pregnancy. They need to stretch. Well, the veins are a consequence of that because they stretch along with it, and then maybe they don't recoil back down to normal size. So again, conditions that put excess pressure on the leg veins, standing on your feet for long periods of time, obesity or being overweight, that's putting more pressure, more weight on everything, so it's harder for the blood to flow up against gravity. Pregnancy, again, as I mentioned. History of blood clots. This is something that's very important to mention because it kind of changes the way we think about varicose veins on their own. But people, if we think of the venous system in the whole body, it's a large network of veins. And that large network of veins, the whole job of it is to bring blood back to your heart. Well, just like if you have I-95 and I-95 is closed down, everybody's going to go around the side roads. Well, the side roads get jammed up and they get really busy. So if you have a blood clot in your deep veins, which are the main highway, the I-95 of your body, then all the blood has to travel through some side road, and that side road are these veins that are closer to your skin or in your skin. And so those see a lot more blood flow than they should, so they dilate and they get bigger and they turn into varicose veins. The reason I kind of differentiated is the treatment and the care of somebody who might have had a blood clot who has varicose veins might be very different from somebody who didn't have a blood clot. So going back to kind of how this works, and I don't mean to go through an anatomy lesson or make this extremely complicated, but I just want to separate the system into two. And I'll speak loud, I just want to come out so I can see this. So I talked that there's the deep venous system where you get blood clots or DVTs. And if you see the veins that are in purple here, and they extend all the way down, and this is a view from the front, this is a view from the side. The purple veins are the deep veins. So that's the main highway, and that's the one that we're really concerned about, that we want to stay open. And then if you get a clot in one of those veins, that's the potential of traveling to the lungs and causing a pulmonary embolism, which could be life-threatening. The veins that are highlighted in blue are the superficial veins. And they're the veins that we're mostly concerned with in varicose veins. And that's because historically, when we've studied varicose veins, we found that those are the veins that have the problem. Those are the veins that aren't able to efficiently return the blood back to the heart against gravity. The one that we talk about the most is the great saphenous vein. And the great saphenous vein you may have heard of. The great saphenous vein is the one that they take when they do bypass surgery. But that's also the one that's most commonly involved in varicose veins of the legs. So I said that our veins need to work against gravity. How do they do that? Essentially, you need to have a pump. So in the arteries, you have the heart. The heart is a muscle that squeezes and pushes blood throughout your body and gets oxygenated blood to every part of your body that needs blood and oxygen. The veins are the return. So how is a vein that doesn't have a pump able to move blood against gravity? And the way it does it is through muscles. So our calf muscles, when we walk, are the so-called heart of the legs. So every time we walk, every time we do this motion, and we flex the calf muscles, we're squeezing the blood out of the veins like a tube of toothpaste and pushing them up our leg against gravity. Well, you can imagine, as soon as you relax that muscle, the blood's just going to fall back down. And that's why our veins are created with valves inside. So, as you squeeze and you lift the heel, as this diagram does, the valves open, allowing the blood to flow. And then when you relax that muscle, the valves close and hold the blood in place. So we have a series of valves running all the way up our legs. Open and close, open and close. The blood climbs them kind of like a stepladder, eventually reaching back to the heart. So what happens when the valves fail? And that's when we have a problem. And that's when varicose veins happen, or that's when increased pressure happens, or venous hypertension, or venous insufficiency. So we have a lot of words for the same problem. So how this happens is essentially the valves get damaged. Now, we discuss a lot as to what's the primary problem. Is it the valve that gets damaged first, or is it because you're genetically predisposed to your veins getting dilated? Probably more complicated than it needs to be, but the point is that at the end result is the valves stop working. So the blood flows up and the valves open, and then when the valves are supposed to close, they don't, and the blood flows back down. Over time, more and more blood is flowing back down. It's kind of like a waterfall hitting rocks. And it's just flowing and flowing, and more and more and more, and it's pounding and pounding and pounding on these vein walls. And as it's pounding on these vein walls, all they can do is stretch and stretch and stretch and stretch. So if you can imagine what this is going to cause, the symptoms are pretty easy to think of, because this is a pressure problem. this is a problem of blood not being able to flow out of the legs and developing a lot of pressure. And so the symptoms that people feel when they have varicose veins, or when they have, more importantly, the problem of venous pressure or venous hypertension or venous backflow, as I said on the slide before, they get tired, heavy, achy legs, usually at the end of the day, usually after long periods of standing or sitting when they're not doing this motion with their legs and pumping the blood out of their legs. A lot of other symptoms that we've seen, fatigue, restlessness, night cramps, itching, all can be seen, but the more common symptoms that we see are the achy, heavy, throbbing legs. This results in loss of days at work, disability, inability to play with your kids, your grandkids, go, do normal day-to-day activities which deteriorate your quality of life. What makes your symptoms worse? Again, we can kind of put this together as we're thinking about the problem. This is a problem again. The valves aren't working right and the blood is flowing down. So what makes your symptoms worse? Standing makes your symptoms worse. So people who have jobs that force them to be on their feet all day long, they're going to start to notice it more, and they're going to be tired at the end of the day. Any periods of prolonged sitting or standing. Hormones, as we said, causes things to stretch, like pregnancy. We need things to stretch, but we don't want the veins to stretch. So that's something that can make the symptoms worse. Warm weather climates, again, you know that your hands swell, you know that things swell up in warm, humid temperatures. Veins are no different. Veins are going to fill and swell in warm, humid temperatures. Air travel is an interesting one. I think air travel, mostly people have more symptoms because they're sitting for long periods of time more than anything. The pressure changes in the airplane are something to think about and something to worry about. And it's always a good precaution to stay very hydrated on airplanes. Wear compression stockings if you want to on airplanes. And get up and walk around frequently, because that's what's going to be good for your circulation. That's what's going to protect you the most against mostly developing a blood clot, but also having symptoms if you have this problem. So I've been talking about the worst case scenario, so I wanted to show a couple pictures of what that looks like. Mostly so you have an idea, if that's you, if that's what your legs look like, you can say, let me go seek some care. But this is a result of long-standing increased pressure. And the pressure essentially builds up, causes scarring, inflammation in the tissues, in the skin, in the tissues under the skin, and eventually can break down the skin. And here we have that entire progression. So starting with discoloration of the skin, to scarring of the skin, kind of this narrow area around the ankle. This looks like probably a healed ulcer, and this is what an ulcer that's open looks like. And so, obviously, when you have an open ulcer, we need to take care of the ulcer first, and then we can take care of the vein problem. So what do you do if you think you might have one of these problems? Obviously, go see a vascular specialist. Go see somebody who specializes in taking care of people with vein problems or vascular disease of any type. The first thing that they're going to want to do is an ultrasound of your legs. Ultrasound's a great technology to see the legs, to see the veins in the legs, because they're very close to the skin. And they let us assess real time what the flow is in the veins. So they let us look at what direction the blood is flowing. I've been showing you a lot of diagrams of blood flowing up towards the heart and then leaking back down and the valve's not working. So ultrasound allows you to see that in real time. So now we're going to go through a little bit of a picture show, kind of what might you have, and go through maybe the different types of vein problems you might see. We'll start with kind of the least severe and go to the more severe. So starting with the least severe, we have spider veins. I'm sure everybody's seen them. Many people may have them. Dilated, purple, reddish veins kind of in the skin surface, frequently seen on the outside of the leg or behind the knee. In some people, these do cause symptoms, and they cause pain and heaviness and discomfort. So it can be helpful to treat them. Sometimes they can be associated with a larger problem of leaking veins, of that great saphenous vein, the larger vein that might not be working normally. And so that may be something that may be worthwhile treating to help with those underlying symptoms. Here's just another picture of somebody, and this is somebody who had a leaking great saphenous vein. And so and you can see pretty much all they had were these spider veins here on the inner side of the leg, but after closing the leaking vein and taking care of the spider veins, this is what they look like in the end, and their symptoms were resolved. Reticular veins are kind of the next step up. So these are dilated blue veins, usually 1 to 4 millimeters in size. They're our normal network of veins under the skin, kind of like the normal network you might see on your hand or on the top of your foot. But reticular veins can be abnormal too, and when they do become abnormal, frequently they're associated maybe with some spider veins in the area. So if that's the case, something may be leaking from underneath and causing too much pressure to develop in this middle vein that then leads to the dilated veins in the skin. So again, it's more about what maybe I'm looking for as far as ways to treat and ways to understand what might be going on and how to focus the care for an individual. Then varicose veins we're familiar with. Again, dilated, tortuous, elongated veins under the skin surface. Frequently, or almost always I should say, associated with abnormally functioning valves in the great and small saphenous vein, or some variant of those veins, causing increased pressure in these veins and causing them to dilate, elongate, and stretch. What are your treatment options? What can we do to take care of the problem, your pain or the visible varicose spider veins? The most conservative thing to do is, well, you could do what this lady did, you could just cover them up. But the easiest thing to do, and what most people will do on their own, is go out and buy compression socks. What are compression socks? Compression therapy or compression stockings or compression socks are essentially medically graded socks that squeeze more at the ankle and less as they go up. So their function is to accentuate that calf muscle pump that we talked about. Essentially, we want to help your veins push blood against gravity and hold them up. So we're increasing the pressure on the outside of the veins with the socks, helping your muscles contract and squeeze the blood up, and helping those leaky valves because there's not as much space for the blood to go down into because we're squeezing those veins down at the bottom. This is the simplest treatment for vein-related symptoms. It will help with the heaviness, the pain, the achiness in some people, but it's not going to cure the underlying problem. If there's a leaking vein there, there's no way that putting something compressing on the outside is going to stop that vein from leaking. Other things you can do, behavioral things really, avoid long periods of sitting or standing. Once again, pressure is the problem, and when we stand on our feet, we have to work against gravity. So if you sit at a desk all day long, or you stand on your feet, if you're a nurse and you're on your feet all day long, trying to take breaks and sit down. If you're somebody who sits in an office job in a chair all day long, getting up once an hour and maybe walking around and moving the blood around is going to help. Weight is an important issue. Keeping your weight as close to ideal as possible is important because that, again, if you're more sedentary, you're going to have more vein problems and your blood isn't going to be circulating as well. And also the weight is causing a problem. It's putting more pressure on those veins so they're not able to work against gravity. Sclerotherapy. Sclerotherapy is a treatment that we do in the office, and this is a way to eliminate spider veins. It's something that we use alone if they're only spider veins, or it's something we use along with other treatments to close the leaking vein or the problem vein. They're usually done with very small needles. The needles are smaller than your typical flu shot needle. The treatment takes about 15 or 20 minutes. And all that's really required is that you wear a support stocking or a compression stocking for about a week afterwards to help in closing the veins. I didn't just put this up here to have a picture of a needle on the screen, but rather I wanted to show you guys a video because I think it really helps detail what exactly we're doing in sclerotherapy but we're essentially getting into these veins and pushing the blood that's in them out and replacing it with a medicine that actually irritates the lining of the vein and causes them to scar down and close so that they don't fill anymore. Take that off before somebody gets sick from the blood. So I keep talking about the leaking vein as the primary problem. So what are the options of treating the leaking vein, the problem vein, the one that's causing all the pressure? Well, 20, 30 years ago, the treatment would be to have something you may have heard of, a ligation and stripping procedure. That procedure is basically making an incision, taking a tool, and ripping this vein out of your body because you don't need it anymore. So that's one way to close it. Just take it out. So Dr. Min, who's the chairman of my department now, was one of the people who developed this procedure, which is putting a small laser fiber inside the vein and actually sealing it closed. And it's a brilliant idea. Why not take, if you don't need to take it out, let's just close it so it doesn't leak anymore. And that's really caught on, and that's now the standard of care in the last 10 or 15 years. So how's it done? It's done in the office. It's minimally invasive. It's done with ultrasound guidance. So basically an IV is put inside the vein at some point along, probably right where it starts to cause the varicose veins. Through that IV, we insert a laser fiber, and then we put a lot of numbing medicine around the vein to insulate the area so that the heat doesn't escape to other areas nearby. And then we turn the laser fiber on and pull it back through the vein very slowly. By doing that, we're causing heat injury to the inner wall of the vein, and it just seals closed. And so it's not leaking anymore. Now many people will ask me, well, where's the blood going to go? Well, we have a big network of veins, including our deep veins, which are more important, that are going to carry blood back to your heart. This leaking vein is causing more work for all of your normal veins because it's causing more blood to leak down, so more blood needs to come up through the other pathways. So if we get rid of the leaking vein, the circulation is better. As a result, most people, I'd say 95 to 100% of people will have resolution of their symptoms of heaviness, pain, and pressure when you get rid of the leaking vein problem. So it's a nice, simple, easy thing that you can do in the office and get rid of a big problem, as you can tell.
Do you only find the ultrasound?
That's the best way to find it because the ultrasound lets you look live. So by holding the ultrasound right on the vein, I can actually see the direction of blood flow. And then I can squeeze your leg, I can squeeze blood up through that vein, and I can see it flow in what direction it's going to flow when I squeeze, and then I can see what direction it's going to flow when I let go. So essentially I'm mimicking that calf pump. So I'm mimicking your physiology, I'm mimicking what your veins are normally doing, and I'm seeing, are they leaking or are they not leaking? An MRI is getting close to there, but it's a much more involved test, and probably ultrasound is better because it's live. MRI just takes snapshots of pictures. CAT scans, again, also take snapshots in time, kind of like a still image, but ultrasound lets you see things in action. Ambulatory phlebectomy. So this is probably the hardest for people to understand, and this is kind of where old things become new again. So this is something that was frequently utilized, but went out of favor and now is back in favor. This is kind of similar to the stripping procedure, except we're not stripping that big vein. We're just going to take out the varicose veins themselves. So after you close the leaking vein so it's not leaking anymore, through very tiny 1 or 2 millimeter little skin nicks, you can actually pull these varicose veins out. So it's kind of make tiny 1 millimeter skin nicks, use something like a crochet hook in there, and we tease the veins out, and then, sounds kind of gruesome, but it's not.
comforter and a Afghan.
As I said, the nicks are very small. There's no stitches necessary. Everybody walks after these procedures. We want people to walk in. We want people to walk out. The reason for that is we want normal blood flow in your normal veins, in your deep veins. We don't want anybody to develop a blood clot. And so we want everybody to walk after this and protect their normal veins, because that's what's going to get the most flow through the normal veins and protect your normal veins after any sort of procedure. All right, so we're going to play a little bit of a game after this. So myth or fact, and we'll let kind of some audience participation if people want to call out what they think.
Yes.
So, exactly. Excess weight can contribute to venous insufficiency. It's definitely a risk factor for forming varicose veins, maybe partly because of the inactivity, maybe partly because of the increased pressure. When you're carrying extra weight, it puts excess pressure in your abdomen, and veins have to come up through that excess pressure. If they can't get through that pressure, then the blood's going to pool in the legs even more. So it's important to maintain a healthy weight to reduce the risk of chronic venous insufficiency, that word again, but increased pressure in the veins or varicose veins. What do you guys think? Dehydration is shown to contribute to varicose veins and chronic venous insufficiency.
Yeah,
True.
So dehydration should not affect the development of varicose veins. I'd say dehydration can be associated with blood clots in your deep veins, because if you're dehydrated, then the flow is more sluggish, and as flow gets more sluggish, then you're more likely to develop a blood clot. But as far as varicose veins, this is more of a pressure. It's actually too much flow, right? People who are pregnant have it. When we're standing and there's too much blood flow in our legs, we get varicose veins, but not necessarily a cause from dehydration. Trauma, other problems, other surgeries to the veins in the legs, like I said, people who had prior blood clots, if you close down the main channels, then the other channels become the pathway and get dilated. So that's why I put the trauma thing in here. Sometimes that contributes. If people had trauma and injury to some other veins, they may develop venous insufficiency or varicose veins, but that's a separate reason from why we normally see it. All right, crossing your legs contributes to varicose veins.
Yes.
Everybody says yes?
Yes.
Really?
No.
That's what
No. But this is the most common myth. This is what everybody thinks, that crossing your legs is going to block the blood flow. That crossing your legs isn't allowing the blood to flow back up against gravity, or isn't allowing the blood to flow up your legs, and so you're going to get varicose veins. And it's actually not true at all. It has very little correlation. It really has to do with sitting for long periods of time is probably more the risk factor, and so when we think about it, that's probably why people put those two together. All right, a couple more. Men don't get varicose veins. They do, absolutely. 40 to 45% of men will have visible varicose veins.
Yes.
These problem veins are necessary for my circulation.
We wondered about that. Yeah.
So,
Let's hope not.
false. So, yes, they're a part of your circulation, but they're leaking. They're causing more work for your body to return blood to your heart. So, your normal veins are having to work that much harder to pump the blood back up. And so these leaky veins contribute to poor circulation. They're contributing to more blood pooling in your legs. And so removing these veins improves your blood return, improves your circulation. If you have skin changes or ulcers in the legs, removing that pressure, that leaking vein, can help with that. At least help it not progress any further, and sometimes make it better. All right, varicose veins put you at a higher risk of developing a deep vein thrombosis, or DVT. Not really. I don't know if it's a false, but it's a not really. So the real risk is not much above the normal population for developing a blood clot or DVT. The important things to minimize your risk of developing a DVT, avoiding long periods of sitting or standing. Any sort of immobility is going to put you at risk for developing a blood clot. Using graduated compression stocking. Well, that helps. We know that helps with circulation, so that's going to help prevent maybe developing a blood clot, especially during long air travel or car travel. And staying hydrated is important. I don't think I have that listed here. And other things around times of surgery. So surgery is a time where we're always worried about blood clots. And the reason that surgery is a time where we worry about blood clots is surgery causes a lot of inflammation in your body and causes inflammatory factors to circulate throughout your body. And those inflammatory factors could put you at risk for blood clot. Also, when you're recovering from major surgery, what are you doing? You're lying in bed and you're not moving. So you're not doing this very much. So you're not pumping blood very much. So that blood is sitting there and pooling in the veins. And anything that pools in the body pretty much isn't good. So pooling blood turns into blood clots. And that's why that happens. And so, yes, the problem of varicose veins causes blood to pool more in the lower legs. But we haven't found that people who have leaky veins are at higher risk of a deep vein thrombosis. People with varicose veins might develop clots in the varicose veins, but those are not deep vein thrombosis and don't put you at the same risk of a deep vein thrombosis. Does that make sense? All right. So now we're just going to go through a quick slideshow going some of our success stories. So here you have spider veins before and after. These are all done with just that sclerotherapy treatment. Here's another common area we see spider veins on the outside of the leg, which are completely disappeared. And here we have varicose veins coming in, and this was a woman who had multiple pregnancies, and the problem she had wasn't in the saphenous vein, but she had leaking veins coming from the pelvis. And so we injected all of these veins with that sclerotherapy, and we're able to get rid of them and get rid of her symptoms as well. Couple more. Here, this was somebody who had a leaking great saphenous vein and had these varicose veins. So we had to combine treatments. So we did the EVLT procedure to close the leaking great saphenous vein, and then did injections to get rid of these varicose veins. And similarly with these other two patients, same process. So it almost looks like I did some computer Photoshop work and was able to get rid of these. But the truth is most of these people, maybe not the ones on the slide before, were having symptoms. Pain, discomfort, heaviness. And had they left it untreated, maybe the visible varicose veins would have just gotten bigger and bigger slowly over time, but they would have been at risk for worsening disease. Maybe, I don't know if it projects well, some skin changes at the ankle, like he had here. He started having some purple discoloration down here at the ankle, and after we treated him, it looks a lot better. So that's a more important concern that we want to try to prevent. Thank you very much, and happy to answer any questions you may have.